of which is called Positive Direction and Associates Incorporated. We are a consulting and a counseling company that really deals a lot with women that are pregnant and also that have used opioids in the past or currently using while pregnant. Our job as consultants is we really work very hard to connect the provider for Suboxone or for Subutex with the mom, making sure that they have a healthy pregnancy and in turn creates a healthy baby. We have a program that we actually just started a few months back, which is wonderful. It's called Healthy Plus Me equals Healthy We. And Healthy We is combined together into one word, mainly because we really want moms to understand that if they are healthy physically, emotionally, then therefore the baby as well as the family will do the same. So the presentation that I'm giving to you this afternoon is regarding pregnancy and opioid use or opioid dependence. And I wanted to share the information of what we do here in the Buffalo area, well not here in the Buffalo area, but back home. And tomorrow is part 2, where I actually share with you the actual application or the pedagogy, looking at a workbook, handling with the mom and the provider and the OBGYN, and how Positive Direction and Associates is the glue. We are actually the glue that keeps everyone informed. And basically what we do is what our keynote speaker talked about this afternoon at 12:30, speaking about the comprehensive services and how it has a long-term effect on economics, on families, as well as on the health and longevity of the mom and the baby. So we will begin. The objectives here for your training for this afternoon are as follows. We will identify the use of the opioids in the population of women. We will also identify the results of infant exposure. I want all the gentlemen in the room to understand that I'm not leaving you out. I'm not. It's basically I want to make sure that the women are covered. And then dads are always invited into all of our sessions as well as to understand what's happening, which makes a really healthy relationship. We also will describe and discuss neonatal abstinence syndrome along with recognizing the short-term as well as the long-term effects. And lastly, we will have a pretty short discussion and then tomorrow will be more lengthy on breastfeeding and the benefits of breastfeeding with babies that are neonatal abstinence syndrome. To begin with, as we all know, here in Arizona as well as across the country, there is an epidemic with opioid use. It's a real big epidemic, primarily with women. Why is that? Because women have the prescriptions written out a lot more frequently than men. One more time, you're probably thinking to yourself, well, why does that happen? When you have back problems, when you don't feel well, when you have a cold, such as I have now, and you need medications, sometimes an opioid is put into the medication to assist you. At certain times, most women don't wake up in the morning and say, by the way, I think I would like to be addicted for the rest of my life. That does not happen. It's a very slippery slope, and that's what we will talk about in a very short detail this afternoon. We also will understand what are the complications or the causes and misuse of prescriptions. When you go to the dentist office and you get a tooth pulled, what do they give you? There you go. When you go to the hospital and you may deliver a baby, what are you given upon discharge? Prescription Revolora tabs and other things that will help you with the pain. So we have a very high number of prescriptions that are written by nurse practitioners, by OBGYNs, by dentists, by emergency room doctors, by orthopedic surgeons. The list continues. So it just doesn't stop with one physician. It actually can continue amongst others, which is why some of our women are able to shop for more medications according to their ailments. Some of the complications that you may consider when you're working with your women in your various agencies around the state of Arizona, the complications are insomnia. Once a woman begins to use opioids on a regular basis, Sometimes she may have a hard time sleeping, and then go to the doctor, and then we are prescribed sleeping medication. So now we will have a mixture that can be very dangerous, or a cocktail that can actually lead to death. We have to realize that there are gastrointestinal issues. Constipation is a very big issue with women in general, but then if you add an opioid on top of it, you will have more complications, which can lead to other health issues later on. Also, a mixture of alcohol and the opioid can lead to death. For some women, they may have a half a glass of wine at night before going to sleep because it relaxes them. Unlike green tea or chamomile, some women may enjoy a half a glass of wine, not thinking that a few hours previous, I took my medication, I took my opioid that was prescribed. The mixture can definitely cause death. The CDC explained that in 2015, we had 486,000 women that died by accidental overdoses. And that is really something that's important. So the women that I see in the Buffalo, New York area, I explain to them, if you are given an opioid or you're given Subutex or even methadone, we will make a conscious effort not to drink. A half a glass of wine, a beer, or anything. We will make a conscious effort to continue to be clean and sober. Also, dependence can happen very quickly. Once the body and the brain gets used to using the opioid and the results of what will happen, dependence happens very fast. What we will talk about in a little while is what are the symptoms that you may see in order to understand and realize that there is dependence or misuse happening for the women. Other drug information that I want you to be aware of is that women between the ages of 25 and 54 are most likely prescribed the medications. Why at the age of 25, do you think? Most times we are athletes. Athletes have, medical issues that may happen in various surgeries, knee replacements, back problems, elbow issues, and what happens once you are done with that surgery, for your discharge plan, you are given medication. Chronic pain, back pain, fibromyalgia, which we cannot find what on earth that is and what will happen. Research doesn't give us much information, but what physicians do know very clearly is that if you give a woman an opioid medication and it's taken as prescribed, it can basically maintain the pain of the woman that she's experiencing with the fibromyalgia. So that's something to definitely keep in mind. And earlier I had mentioned to you delivery. What is an opioid? As we all know, because all of us are very educated here, it's an analgesic. It's a pain inhibitor. It also affects the physiological respiratory system. I explain to a lot of my students at Canisius College, where I am an adjunct professor, that an overdose does not look like it does on the movies. In the movies, you see someone that may use the drug and then they collapse and we're done. And then the EMT comes and says, they're gone, that's it, it's over. That doesn't happen. The respiratory system slows down very slowly to the point where the person has difficulties with breathing. You actually can see the difficulty in breathing. It's labor breathing. So because I'm short and this podium is a little hot, I can actually show you. The breathing is clavicle. Person is really struggling. As they struggle, that is the beginning of an overdose, or the beginning of their respiratory system shutting down. Opioids can do one of two things. They can assist you with the respiratory system, which is opening up your bronchial tubes if you have bronchitis, or an overuse can shut the respiratory system down, and that's what happens in overuse of it. Effects of brain function as well as nervous system, that also is an issue, and releases histamines that causes skin irritation, which is why some of our patients that we may see may have various sores on their skin, may scratch continuously, and will tell you, I feel like there's something crawling on my skin. What do I do? Then we understand they may have told us that they have not been using, but those comments will lead you to realize there may have been a use in the past few hours before they sat across from you. And also secondary amenorrhea, which means that women miss their menstrual cycle. Opioids have a half half-life of 24 to 36 hours, and after that time, withdrawal symptoms can occur and begin to happen. And I also explained to moms and dads, as well as the students that I train in Buffalo, what does this look like when a person is going through withdrawal? If you've ever experienced the flu, or if you've ever seen anyone with the flu, that's what it looks like times 2. And that will help for understanding. For withdrawal, you may have an individual that may be confused, they may have delirium, they may vomit, they may shake, they may tell you in 110-degree weather, I am freezing cold, I need a sweater. That's a problem. Therefore, we know that there's some withdrawal symptoms coming through. And the remainder of those that you've seen up on the board, which I will not read to you because I know you know them. How do we handle withdrawal? Well, we handle withdrawal across the country in 2 ways. We can medically manage someone with the use of methadone and titrate them down over 5 days, or we can use a buprenorphine, or we can use Suboxone. Those methods are used across the country and are very familiar to all of us. But in our talk today, I will explain to you how some of those methods are used during pregnancy. Some of the reasons that some of our women that sit across from us may not even realize that they're pregnant. They miss their menstrual cycle. When the menstrual cycle is missed, some women believe it's normal because I'm using continuously, but not thinking I may have had unprotected sex. And as a result, I might be pregnant. So if you want to, you can follow some of the procedures that we do at Positive Direction and Associates. We actually give calendars, and the individual will write down when their last menstrual cycle was. If they're able to do that, then we're able to know it's not the drug, you might be pregnant. Let's look at giving you a referral to an OBGYN for an assessment. Also, homelessness and self-care is also an issue. I'm not sure how much you experience this here within the Arizona area, but in our New York State area, we have a high rate of women that are homeless and homeless with children. And sometimes it can be very painful to watch, and the moms may not tell the teachers or anyone else that there's homelessness involved. Self-care follows from that, because if we're homeless, that means that we may not have insurance to take care of ourselves, to check those things out. Also, medical coverage is an issue. For some of my clients that I see back home, there is such a thing as they may not follow through with what needs to happen with Department of Social Services, so they are sanctioned. If they are sanctioned for 45 plus days, that means that they do not have medical coverage, unless they explain to the worker that they may be pregnant and will need extra assistance. Pregnancy warning signs that we also look at very closely a lot are the person may be extremely tired. That could be a number of reasons, but that may be the main cause. Also, tender breasts and sensitivity to smells. That is also a problem that we look at, and complaining of nausea, not related to the use of the opioids, which is something that I want you to pay close attention to. Some of the other concerns that we will have now moving into neonatal abstinence syndrome is the mom. OBGYNs are very concerned about moms. I'm not sure how many of you that do this for a living realize that your OBGYN may not realize that your patient is using drugs or alcohol, or even is addicted. So therefore, we go into a real issue with the OBGYN has the regular concerns of moms, but now let's put on top of that the use of the opioid. So once the OBGYN does understand that this is an issue, these are the concerns that will happen. Toxemia is one thing. Communal infections, hepatitis C and HIV. Majority of the women, when they are pregnant, they get blood tests. The blood tests do look at HIV. However, we want to also be aware that hepatitis C is a continuing problem, and it actually is a bigger problem sometimes than HIV. Hypertension, miscarriages, as well as death. An individual could decide to use, and then they are pregnant, not realizing that hemorrhaging could result because they're not getting the self-care. As a result of the miscarriage, they could also bleed to death, so that's something else to be aware of. The other concerns that the OBGYN, as well as myself as a consultant, has very strict rules about, and we really are so concerned to make sure that the mom is aware that this could happen if they continue using the opioids. Stillbirths. Some women have given birth to their child at 8 months, at 9 months, but it is a stillbirth. The reason why is because the heart wasn't developed correctly because of the continued use. And if the heart is not developed correctly, that means it's not beating, things are not following through correctly. As a result, we have a stillbirth. Low weight is also a concern. The normal weight for a child when they're born is 6 pounds. Some of our babies that are born opioid dependent or opioid exposed, they are less than 6 pounds. Some of them are born at 2 or 3 pounds. And it's such a struggle and it's so painful to watch that we try to figure out what can we do to really help this situation a little bit more. The small head circumference, as you know, in working in the field, if there is a small head circumference, that is an issue later on, such as special education issues that we have to deal with, learning disabilities because of the small head circumference. And that basically means that the brain was not developed correctly because of the use and overuse of opioids. Early delivery, we really hope, and we keep our fingers crossed with different types of medication, encouragement, and nutrition to have the child be born at the normal rate, 39 to 40 weeks. For some women that do not get the self-care or are not talked to earlier or are not given the education, their children are born much earlier, sometimes at 28 to 29 weeks. If we do the math, that is extremely important to realize that we could lose that child. In turn, the emotional issues that happens with a mom that looks at her child that has tubes coming all over, what do we do about that? How does that happen? So I want you to really take in consideration how important it is to stress and to educate with the women that you work with that we need to make sure that we can carry this pregnancy through to the amount of the 9 full months. Not the beginning of the 9th month, but the full 9 months to make sure that the child is born healthy. Death could also be a result. Sometimes the babies are passing away in womb. That's very difficult too, which is another opportunity where the mom has to deliver a stillborn child. And lastly, the bilirubin levels are very high. That means that the liver has some issues, and that is a very easy solvable problem. We actually go under UV light for a few hours or longer, depending on what the neonatologist would like to have for the baby, and then the child is able to go home. So those are the major concerns that the OBGYN has, as well as the counselor, and that you will have following through. For pregnancy, we try very hard to focus on the fetus. We do our best with looking at the safety and the health of the mom. We look at the immediate precautions that need to be taken, and we also look at the potential risk of opioid dependence. We encourage mothers to make sure that they receive the proper treatment throughout their pregnancy and not stop. It's so important that once you start the methadone or once you start the Suboxone, that you actually continue throughout. And also the fetus can be compromised in utero because of continued use of the opioid or the heroin. Sometimes heroin is laced with fentanyl or it's laced with other things that the mom is not aware of. It may not be pure, so therefore those negative particles that are poisonous will go through to the fetus. And then we have another continuing problem that now we have poison going into the developing baby. So it's very important that the mom actually gets involved with a provider, which we help her with. Next, I wanted to talk to you about the opioid maintenance therapies that are important to know about. Methadone is one, which is our golden standard that we have in the United States. Buprenorphine, Suboxone, which is a mixture of naloxone as well as buprenorphine. And then we have Subutex, which is pure buprenorphine, which is what we definitely always encourage moms to have in their system continuously throughout their pregnancy, and that's also given by a provider.
Excuse me,
Yes,
you
ma'am.
encourage them to use the Subutex?
Oh, I can't see you.
Yeah.
hear you.
You're encouraging them to use the Subutex?
Absolutely, yes, yes. For OMTs, we use OMTs to avoid withdrawal. We also do very well with helping them to maintain their daily activities. Majority of the patients that I've had over the past 25 years, because I've been doing this for a very long time, very proud to say I'm going on my 26th year, and any person that I've had that has gone on methadone maintenance, they have been successful. They've gone to school, they've managed their lives, legal issues start to dwindle away. We find that it's really helpful. So methadone maintenance has been our golden standard, and we do have other medications that are coming into play now that we're learning more studies about so that we can find out other ways that we can assist our individuals. Vivitrol is another one that we're starting to look at more closely. We need more studies though for the efficacy of that at this point in time. We also look at use during pregnancy for safety protocol. Safety protocol is very important when you're looking at pregnancy because you not only are dealing with the mother, but now you're dealing with another human life that is very precious to all of us. It's one piece when you see a teenager walking in the room, but as soon as a baby walks in the room, what do? Oh. And it actually is warming to your heart. So when you're working with any woman that is pregnant, think of that warmth in your heart because you have that child that you're actually helping to develop. For what we have right now for the OMTs according to SAMHSA from 2008, if a mom is later on in her pregnancy and she is given Suboxone, we have found out that the naloxone in there can actually have some skeletal development issues. And we saw that only in animals. We have not seen that in humans. And because of that, there's a black box warning if a mom is prescribed the Suboxone that this could be the result, which is why, ma'am, you had mentioned about the Subutex. For the pharmacy piece here, we know about the precautions, and that's from Jones and Fiedler in 2015. We talk about the immediate evaluation of moms and switching to buprenorphine if we can. Some moms do not come for treatment or early care for their pregnancy until almost the 4th or 5th month. Think about how many weeks have gone by. That's very scary. So by this time, we're looking at development of the mom. Does she have the appropriate weight gain? What other drugs have been used besides the opioids, besides the heroin, besides pills? We have to also look at that, and the person needs to be safely transferred to take buprenorphine, which is also a Subutex, which is the name that we use over the prescription piece. To do the evaluation, this is what the protocol that we use in New York State. At certain times, not every woman has to be hospitalized, but we do look at it very closely. We discuss the potential fetal development. In order to know that, we have to give a sonogram. Medicaid or the insurance company will definitely assist with that and pay for that so that we're able to look at how many weeks. We look at the last menstrual cycle, and then we look at the sonogram and we compare with research where on earth are we at in this development? How is this happening? If the mom is underweight, under nutrients, we make sure that they are hospitalized, and they can be hospitalized up to 72 hours. Sometimes some women are dehydrated, so we need to give the IV to hydrate them right back up right away. Part of why we have early deliveries or Braxton Hicks is because of dehydration, not enough water. A lot of my moms say, well, I had Kool-Aid, I had coffee, I had iced tea. That's a liquid, that's not water. I explained to them very closely and very clearly that your entire, where your baby is living is in water, not iced tea, not coffee, not Kool-Aid, water. So if your baby is living in water, we have to give more because as you sweat, as you urinate, as you move your bowels, you will lose the water, so we have to put more in. Up until the 9th month, you should be drinking close to 96 ounces of water a day. They get very angry at me when they hear that. And I say, well, it's okay, you'll be very happy, less pain, and you'll have a very easy pregnancy. So we really work and push the water piece, that's so important. And we also monitor any withdrawal symptoms that the mom may have at the time. Identifying the length of the pregnancy is extremely important. Then we know the date that we may possibly be delivering. If we know the date of delivery, then we can actually start preparing. Because some of my moms may not have the right equipment when they're at their homes to take care of their baby. So it gives me a little bit of time, not a lot, but a little bit of time. And we also identify in the past if there's been any miscarriages or pregnancies. One of my moms actually realized that the reason why she had a miscarriage was because she used heroin throughout the time of the pregnancy. She did not transfer to buprenorphine. She did not go on methadone. And she lost her baby in the 5th month of pregnancy. She assumed that if I'm using heroin, I can use it the entire time, as long as I maintain. And then later in the pregnancy, she decided to use more. And I explained to her, the medication that you're buying on the street is not pure, and it is not given by a provider, so therefore you're putting more poison into your body and into your child's body. And then we had other issues, and that's the reason why she had the miscarriage. So we already discussed methadone maintenance, and as you see, it's a lady here who drinks her methadone maintenance. Some of the women that I have, they actually have take-homes where they go to the clinic once a week and they're able to get their take-homes, and it makes life a lot easier for them, especially later on in pregnancy. To waddle to the methadone clinic could be stressful. So therefore, we really make sure that they can get take-homes later. As I mentioned to you earlier in the talk, that methadone is our golden standard that we have used over the years since the 1960s and has been used quietly in methadone maintenance clinics for pregnant women. And also what we find is that some infants are born with some difficulties because of using the methadone throughout the time of the pregnancy. And we'll go through that as to how we actually handle those situations later on. We also find that the woman's weight needs to be considered. A woman may start with a certain milligrams of methadone early in their pregnancy, and then as the baby grows and they gain weight, we find that the methadone does not hold, so we need to increase the methadone milligrams. Very important for the woman to make sure that they see their physician. The physician is talked to about they are on meth maintenance. The meth maintenance department needs to know what's happening with the OBGYN and the weight. So when a woman comes to my company for consultation, every time we meet, they weigh themselves. And then when I do my progress note, sent over to the OBGYN or sent over to the methadone maintenance clinic, the weight is on there so that the provider is able to compare and see what is actually happening with the mom. Did she lose weight? Did she gain weight? Has she stayed the same? So that's very important. Also, we look at looking at other drugs that were administered besides the opioid, and what we have found a lot is alcohol is used, so you have fetal alcohol syndrome, which is part of that too. From the Journal of Pediatrics in 2016, which is the most recent article that I was able to research and find, which I thought was extremely helpful for our talk for today, so that you had good information. What we find is that individuals that may have taken the methadone maintenance throughout their pregnancy, their babies may be born with opioid acute withdrawal, which is also called neonatal abstinence syndrome, or NAS for short. These infants are born with the average weight 6 pounds or more, and actually the moms survive throughout the entire pregnancy. They actually deliver on the 40th week, which is wonderful. We are so excited about that. I've only had a few moms that have had a C-section. The remainder of my moms have given vaginal births, and the methadone is given to them in the hospital. So what we always do is find out what was the last dose and maintain them on that dose. Speak to the pharmacist at the hospital where they deliver, and the pharmacist will then make sure that that medication is written as an order, and then the woman is given the methadone each time when it's prescribed until she is discharged. Then she returns back to her methadone maintenance clinic, and those issues are then discussed further as to if she would like to titrate down or if she's interested in doing something different. The other part that is so important is that you have a choice. For some of my ladies that were not on methadone already or were not on Suboxone already, they were just using heroin on the street or taking pills. they had a choice. They could choose the methadone maintenance or they could choose the Subutex. Sometimes it's not their choice. It depends on what clinic can get them in the fastest. As we all know, with the way things are in the United States, those providers can only do 100 prescriptions of the Subutex. It's going up to 250, 275 very shortly. We're waiting on Congress to stop arguing and sign, which would be wonderful.
They're on break right
That's when, so in September, hopefully that will happen, right? So if that happens, then there might be more room, which we really hope for also. But the buprenorphine is also used at that particular time, if that is the mom's choice. According to the pediatrics in 2016, with that article that I mentioned to you earlier, they actually did a comparison of methadone maintenance and Subutex. And for the Subutex, they noticed that babies are born 38 to 40 weeks, and there's less traces of opioids in their system. And also those children had less opportunities of being in the hospital for a long period of time, suffering from neonatal abstinence syndrome. What we find very clearly is that, and for one of my moms who gave birth actually last week, and they checked her baby's urine, there was absolutely no traces of anything in the system except for the SSRIs that she was taking during her pregnancy, which we definitely said that that's fine for her to do because it will help her to maintain and balance the mental health and the behavioral health. There's more clinical trials that need to be going on for Subutex, and there are some going on around the country as well as in Buffalo, New York. We actually have a few trials happening. For fetal development and birth defects, these birth defects are looked at for women who may not have taken methadone from the very beginning or Subutex from the very beginning of their pregnancy. They were using other substances, and these are some of the birth defects that can happen because of the use. Developmental delays, spina bifida, glaucoma, cleft palate, language delays, heart defects. We also look at the pulmonary valve stenosis, which is a big one that we've actually noticed at Women and Children's Hospital in Buffalo, as well as at Sisters Hospital in Buffalo. We've noticed that is the biggest one that we're noticing for women who may not have switched over to methadone and buprenorphine in time. And the reason why this happens is because the heart and the eyes are developed within the first 3 months. Remember in the beginning of the talk, I said that some women think that they are not pregnant because they missed their menstrual cycle. Well, because they've missed their menstrual cycle and they continue to use, this is the most important time, the first trimester, as to when the child starts to develop the eyes and the heart. So some children may be born with some eye issues, or some children are born blind in some studies that we've looked at in the past. At this point in time, I haven't seen any of my clients that have had that, but some of the babies as they've gotten older have needed some more assistance with eye problems. The embryo also has been developing from conception, and on the 22nd day, the brain is unprotected. Toxins can still come in, which is where you get the language delays from. And also the heart starts to beat by the 22nd day, and that's where you get those heart deformities that may happen because the mom is continuing to use. So the first trimester is super important. When I see women in my practice, I also explain to them very clearly, you may not want to get pregnant, but you are an adult, and I'm sure you're having some fun. So because of that, we need to prepare for unwanted pregnancy, unplanned pregnancy. And if that is in mind, let's look at how we can actually help you with the addiction, help you with the drug dependence, so that if pregnancy does happen, we have things under control pretty early, rather than wait to the last second and then we're panicking and very worried about the baby. Now I want to move into delivery. Delivery is a very scary, scary time for a mom, for a dad, for extended family members who are involved. And I also have a pregnancy piece that I do with the moms that actually will go into more detail with tomorrow's session for part 2. Is I look at who do you want in the delivery room with you? Not everyone may want someone in the delivery room with them because things can get kind of scary. Well, what I explained to the women is the procedure that happens in the delivery room. Once the child is born, there's such a score that is given to them called the APGAR scores. Many of my moms say, what is that? And what does that mean? So I simply break it down. A is the appearance. How does the baby look? Is the baby blue? Is the baby looking like it's okay? The pulse, grimacing on the face. What does the activity look like? And what does the respiratory look like? The APGAR is given in scores. And I explain to the moms that don't worry and don't panic immediately if the score is a certain number because you're tested again. And it depends on how many tests that you have, which we'll go through next, to figure out if we need to go into the neonatal intensive care unit or not. So each child is born and evaluated. And I explained to them, because one of my moms thought they just gave APGAR scores to women that their babies were born exposed to opioids. So she was assuming that she's being picked on. No, you're not being picked on. That's across the board, that's protocol. That's with AMA, we have to follow that. So then she relaxed a little bit. And I explained to her that it's evaluated 1 and 5, 10 minutes following birth, and then 10 minutes if there are any medical concerns. Each area is a score of 0 to 2, adding up to a high score of 8 of 10. If the score is average of 8 to 10, we're okay. If it's below 8, the baby is tested again. For some of the babies that have neonatal abstinence syndrome, the score may be 8 at the time of birth, and then when they're tested a few minutes later, the scores actually drop. And when the scores drop is when we need to look at the NICU, which is called the Neonatal Intensive Care Unit. And I want you to be aware that even though the mom has methadone or buprenorphine or Subutex, they can also have scores of 8 or below. It all depends on the baby, and it all depends on what's happening at the time. So I don't want you to think that the APGAR score is better for one than the other. Either one can have that low score. So for neonatal abstinence syndrome, which is something that is not widely publicized in the news, we don't hear about NAS a lot, but we know that it does happen because our moms that we counsel come in and tell us, my baby is in the neonatal intensive care unit, they couldn't come home with me, and what am I going to do? This is very scary for me. So it is my job as a consultant to explain to them what that means, because our neonatologists, they have time to talk, but not a lot of time. And what I always explain to them is the care that needs to happen with the mom so that we can talk about this in more detail. So I explained to them, we have to change our language. Our babies are not born dependent. They did not make the choice to use the drug. It was not their choice to take that opportunity. They were exposed. Because they were exposed, which is why we have the results, is NAS. I try to change the language to exposure is because, like, if you walk in the rain last night when we had the storm in Phoenix, it rained pretty hard. You were exposed to rain. You got wet. Did you do the rain yourself? Nope. It just came down. So as a result, I explained to the mom, we're not going to look at self-blame. We're not going to look at being guilty. We're going to understand that this exposure happened, so now we have to move to our next step. Just as you may have been exposed to rain, what did you do? You used an umbrella. You got a raincoat. You dried yourself off. That's what we do with our babies. We give them umbrellas of protection by giving them medications that can assist them with the withdrawal, and then we give them a pocket of information, which is a lot of TLC, a lot of love and a lot of care, and a lot of skin-to-skin contact so that they feel comforted. What you will find is that babies that have NAS have inconsolable crying. It is a high-pitched cry. Have you ever heard a pipe that is getting ready to burst? How does it sound? I won't do it in the mic because it will really make you mad. But it's very loud and ear-piercing. That's the way an inconsolable cry happens with a mom, with the baby in the NICU. Imagine having 10 to 12 babies in the NICU at one time. Those high-pitched cries are what the nurses will hear for their 12-hour shift. It is extremely tough, extremely painful. With the cry, you have a child that is shaking. They're having a very difficult time with handling the withdrawal. The same way that you may see withdrawal with an adult, it happens with a little person that is 5 pounds or more. And if you think of that and envision that, that's painful to think about, and it's twice as painful for the baby to experience. So sometimes we have to do what's called an extended hospital stay. With extended hospital stay, what we realize is that it is very expensive, and babies stay longer than sometimes 3 to 4 weeks. Sometimes the children cannot go home with the mom, so the moms need to actually come back to the hospital to follow through with different things. There's some statistics that actually I wanted to share with you about NAS that I think will make a pretty good impact for you so that you know. According to 2014, the National Survey on Drug Use and Health Statistics mentioned a few things that I thought was important to bring to your attention. An estimated of 225,000 infants are exposed to illicit substances each year, and our numbers are increasing. 60% to 94% of the neonates exposed to opioids during pregnancy will exhibit symptoms of NAS. Also, infants with NAS have an increase to of birth. Every 25 minutes, we have a baby born with neonatal abstinence syndrome across our country. This accounts for the $1.5 billion in healthcare costs, which includes the hospital care, the Medicaid care, the insurance care, and all the other pediatric specialties that have to happen because of NAS. The average stay for an infant is 16 days plus or minus 5. For some, it can go up to 5 months, depending on other issues that they may have. And usually that means that the mom had exposed them to other drugs besides the opioids. And lastly, we have the $1.5 billion cost in the year of 2012 for babies that are born exposed to opioids. So those are just some statistics that I wanted to share with you this afternoon so that you understand the importance of it. It's definitely impacting our economic system and impacting the time. Because in Buffalo, we have a lot of children that are born exposed, we actually needed to build a second wing. We have a second wing just for NAS. And it's only for those babies because there was no room for the children as they were being born. We needed to find places for them to go and to put them. That's not fair to the babies. We need to make sure that they're comfortable, just like the other counterparts inside the hospital. So there's more hospitals being built in other areas that are building other parts so that we can take care of our children. I want you to know that at 3 to 12 days, you can still, 3 hours to 12 days after birth, you can still show NAS symptoms. So 3 hours after birth, you can have that, and then up to 12 days. The 12th day is tough, especially if the baby is sent home. That's where we need to make sure pediatricians are on board to understand what NAS looks like, so that when the mom brings the baby in and says, the baby isn't eating, I'm not understanding, they're crying a lot, there's a lot of fidgeting going on, high peers crying, what do I do? The pediatrician doesn't always automatically go to, you have a colic child, or maybe you need to do something different. We can now realize that there's NAS involved and then immediately take the child to the emergency room to be admitted to the hospital to be given medication. NAS can also be found in nicotine and also babies that are exposed to benzodiazepine. So some of our children that we have at the hospital have exposure to tobacco. I had one mom who actually smoked a pack of cigarettes a day, and her child was born with NAS. And she said, well, I'm not using any drugs, I don't understand. I said, well, tobacco is a drug. And she says, oh, but it's not as bad as all the other drugs. Right? I said, it may not be, but your baby has NAS because of exposure, and another baby that had exposure to opiates has NAS also. So our bottom line is NAS. And she says, oh, I get it, okay. I said, all right. Next, we're going to look at what does NAS affect. It affects the neurological system, the gastrointestinal system, and the autonomic system. We're gonna go through each of them, not in major detail because I don't, want to take up too much of your time, but I definitely wanted you to know what they mean. This here is a picture of an infant that is in a neonatal intensive care unit, and the tubes that you see are tubes that help to monitor the heart, help to identify the gastrointestinal system, and right now the baby is chewing on part of what is their tubing. She's trying to chew on there, even though she's not very successful with it. We find for the neurological system what we have is irritability. That's where those cries come in. The babies will stay awake for a long period of time. Anyone who's ever had a child at home will realize that the baby will sleep forever. You're like, oh, they're sleeping again. Yes, I get some like that, right? Well, our children with NAS sleep for maybe 2 hours and wake up and are not very happy. We console, we're able to try to feed a little bit, and then they may go back to sleep for another couple of hours. So their sleep is very broken up. It's not for long periods of time, which is the other reason why they become very irritable after a while. We also realize that they're sneezing often. If you've ever seen a little baby sneeze, it's adorable, very, very adorable. But that's a number one indication when we see continuous sneezing. One sneeze, okay, understand. But when you have 2 and 3 combined together, one after the other, that's when we're saying that those are symptoms of NAS, so we want to be aware of that. Also, stiff arms and stiff legs and tremors. And also we look at the moral reflex, which is basically the child is kicking that heel out and really hurting. Sometimes they really hurt their bottom. So I have to explain to the moms a lot that we need to make sure we have appropriate ointment. We need to have appropriate diapers involved in there, and I always express to them how important it is to change often. We have to make sure that the